So sort of the idea behind peer support is that I am somebody who identifies as having lived experience with mental health and substance use disorder. Sometimes it's a little easier to talk to somebody that has gone through some of those same things that you have. Additionally, I would say that the relationship with a peer support specialist is going to be a little bit different than like a therapist or your traditional provider. Peer support is very big with mutuality, and that is sort of the idea that both people can benefit from having this relationship. And so that just kind of allows a little bit more power sharing. And in addition to the power sharing, I would say that it also allows people to contribute to the relationship. I know in the past when I've been involved in the mental health system, it always feels like I'm going to somebody to receive a service, right? I'm always on the receiving end of that. That person's not really sharing anything about their life with me. And it just sort of feels like you're a problem to be fixed sometimes, and like you don't have anything to contribute. And so being able to have that relationship go both ways can be very empowering for folks.
So in terms of the mobile crisis unit, how does that work, Heather? Does someone call the police department and then they send the mobile crisis unit, or how does that?
So the mobile
happen?
crisis system works. There is a statewide access point number that anybody in New Hampshire can call. It's toll free. And when they call that, there's an agency that answers those calls. They're staffed with peers and clinicians. They'll kind of talk to the person about what's going on for them, what the reason of the call is, and kind of figure out together what support that person needs in the moment. Sometimes that's just that they need that person to talk to them, and that call is resolved without any further intervention. And for the calls that can't be resolved without any further intervention, there are a couple different options. A mobile crisis team, which is usually a clinician and a peer, can be dispatched to the person's home, to their location, to provide some in the moment support. And then for folks that maybe aren't comfy with that, we do also have rapid access appointments. So we're able to get folks into CS within 24 to 48 hours of the initial call that they make to the access point.
Wow. So if I asked you, like, what's working well in Dover right now, would it be the mobile crisis unit and the peer support?
Yeah, absolutely. The mobile crisis unit and peer support in general. There are a lot of like local peer support agencies that are just kind of like a beacon of light in the darkness. And just the fact that peer support is expanding in New Hampshire in general, it's another option for folks.